A very good afternoon and welcome to the session on the topic follow-up of NICU graduates for parental awareness. We are glad to have our Dr. Ramani Ranjan, Senior Consultant and HOD, Neonatology and Pediatrics in Apollo Cradle and Children Hospital, Greater Noida, who will take care of the topic and talk about it briefly. The doctor will help us understand more about the topic in details, highlighting the aspect and the importance of the topic. If you have any query, any comment, just post it in the comment section, and the doctor is here to help you. Doctor, you have the stage now.
Thank you. Thank you for your kind introduction. So, good afternoon, ladies and gentlemen. I'm Dr. Ramani Ranjan, Senior Consultant Neonatology and Pediatrics at Apollo Cradle and Children's Hospital, Greater Noida. And today we will be discussing about NICU graduates, parental awareness, what as parents we should know when our babies go home from NICU. So, NICU, as you know, stands for Neonatal Intensive Care Unit. So, nobody wants that baby should go in NICU at the time of birth. Everybody wants that pregnancy should culminate into a healthy baby and a healthy mother. But at times, because of known reasons and sometimes because of unknown reason, baby lands up in NICU, and so it becomes kind of stressful situation for the family, for the parents when the baby is in NICU because uh, the baby is either very sick or moderately sick, or for any reasons baby cannot be with mother. And in all the situations there is a lot of parental anxiety. And then as medical professionals, as healthcare providers, our job is to treat the baby, keep the parents updated, and if there are any queries during that time, we discuss it on one-to-one basis. So that goes on till the baby is in NICU. We make sure that the parents are on same page as us, and day to day we talk to them, we tell them what is being planned for the day and later on. At the time of discharge, there could be many questions from parent sides, and also we want to make sure the care that we have been providing in NICU is extrapolated at home as well. It's carried forward to the home as well. But it's not easy because you cannot just replicate NICU at home. Of course, the level of care is different. And we discharge babies only after we feel that the baby is safe, baby has attained those criterias which makes him or her suitable enough to go to home. But there are certain things which we need to follow when the babies go home, and that is what we want to discuss today. So this is all about babies who have remained in NICU. So NICU, usually at the time of discharge, parents get a summary of the course of the baby in the hospital, the treatment, whichever is been given, the medicines which are being given, and the medicines which will be given in future, the doses and stuff. Important checks are mentioned in the summary. So it's very, very important to go through the whole summary because there are very important messages which are put across, and we as medical professionals want parents to understand, and that's why it's important to discuss at the time of discharge that everything written in the summary has been understood by the parents. Um, Most of the times we keep discussing these things while the baby is in an ICU, but there are certain things which are time specific and there is time criticality to that, and it's very, very important to conform to those timings. So the first thing is follow up. So when do we need to come next? So usually it's mentioned on the summary itself. Usually when we discharge a baby from an ICU, we call them like some babies in 3 days, some babies in 5 days, and accordingly depending upon baby's condition and the reason for which the baby was kept in an ICU. So follow up is important. So we need to again stick to the timelines, because if we do not follow up in time, we might miss on certain important information. For example, weight gain. How's the weight gain been in last few days since the baby has gone home? How's the feeding been like since the baby has been discharged? Because at home, of course, the mother and there are few other caretakers who will be taking care of the baby. So we need to know how the baby is doing there. And then other concerns which sometimes may not be very obvious or evident when the baby is in an ICU. They come up when the babies go home. How to take care of the baby. So all these things can be discussed when we meet in OPD or clinic after discharge of the baby. So follow-up is very, very important. Timely follow-up is extremely important. And then we should know what are the danger signs. Most discharge summaries will mention what are the danger signs. डेंजर साइन का मतलब होता है कि अगर बच्चा सिक है घर पे, अगर लग रहा है कि कुछ एक साइंस है जो है, जैसे बच्चा अगर फीड नहीं दे रहा, बच्चा लेथार्जिक है, बच्चे की सांस की गति तेज चल रही है, बच्चे का रंग जो है वो नॉर्मल से डिफरेंट है, बच्चे को झटके जैसे आ रहे हैं, बच्चे का टेम्परेचर बहुत ज़्यादा या बहुत कम है, ऐसे कुछ साइंस अगर लगते हैं, बच्चा यूरिन नहीं पास कर रहा 10-12 घंटे, सो ऐसे अगर कुछ साइंस रहते हैं, वी हैव टू सीक मेडिकल अटेंशन एज सुन एज पॉसिबल. सो ये डेंजर साइंस जानने बहुत ज़रूरी है. This is for awareness, not necessarily that every baby will have those signs, but it's important as a parent that you should know and you can appreciate it. जब भी ऐसा लगे, you can seek medical attention. So awareness is very, very important. Then vaccination, of course, before discharge, we usually vaccinate the babies. And then बुकलेट मिलती है, इसमें सारा इन्फॉर्मेशन रहता है कि नेक्स्ट वैक्सीनेशन कौन सा होना है, कब होना है. एंड एज आई सेड, देयर इज टाइम क्रिटिकलिटी टू दैट. हम लोग एक टाइम लाइन के हिसाब से वैक्सीनेट करते हैं, सो दैट बेबीज गेट ऑल द वैक्सीन्स इन टाइम. So it's important that we know when is the next vaccination. If there is any doubt, it's good to discuss with your doctor. सर्टेन अदर चेक्स, जैसे कि अगर बच्चा प्रीटर्म रहा हो तो आरओपी स्क्रीनिंग, आंखों की जांच जो होती है, समटाइम्स वी गेट इट डन एट हॉस्पिटल इटसेल्फ. समटाइम्स the baby is discharged early, we ask them to come after a certain period of time कि भाई आपको आकर आंखों की जांच करानी है, स्पेशली जो बच्चे चौथे सप्ताह के पहले उनकी जिनका जन्म हो गया हो, 2 किलोग्राम से वजन जिनका कम हो, ऐसे बच्चों को आंखों की जांच करानी ज़रूरी है. कभी कभी आंखों की जांच अगर टाइम पे नहीं हुई और रेटिना में इश्यूज हो गए तो बच्चे ब्लाइंड तक हो सकते हैं. तो इट्स वेरी वेरी इंपॉर्टेंट दैट जहाँ पे एडवाइस किया गया हो आरओपी स्क्रीनिंग वो करवाई जाए, आंखों की जांच करवाई जाए और वो समय पर करवाई जाए. ऐसा नहीं है कि अगर टाइम 1 सप्ताह के बाद है तो हम 4 सप्ताह के बाद जांच कराएं. दैट इज नॉट राइट. सो इट्स इंपॉर्टेंट टू स्टिक टू द टाइमलाइंस व्हिच हैज बीन मेंशन्ड इन द समरी. एंड देन देयर कुड बी हियरिंग टेस्ट लाइक बेरा, जो कि हियरिंग जांच करने की बच्चों की होती है, स्पेशली अगर हाई रिस्क बेबीज रहे हैं, बच्चे छोटे रहे हैं, हाई जॉन्डिस रही हो, इन्फेक्शन रहा हो, बहुत सारे अदर फैक्टर्स रहते हैं जहाँ पर कि हम बच्चों की हियरिंग 3 महीने पे करते हैं. बहुत बारी डिस्चार्ज के समय वही स्क्रीनिंग होती है, बट एक कन्फर्मेटरी टेस्ट बेरा कहते हैं, वो हम 3 से 4 महीने में करते हैं. सो दैट इज़ वेरी वेरी इंपॉर्टेंट कि उसको टाइम पे किया जाए. सो दैट इज़ अगेन टाइम स्पेसिफिक, एंड वो हम तभी जानेंगे जब हम फॉलोअप पे मिलते रहेंगे. इसके अलावा सम बेबीज, स्पेशली प्रीटर्म बेबीज, कैन हैव हर्निया. मेल बेबीज कैन हैव अनडिसेंडेड टेस्टस, जिनको हम फॉलोअप में सर्जन से भी मतलब सर्जिकल कंसल्टेशन उनकी होती है. सो इट्स वेरी वेरी इंपॉर्टेंट दैट वी गेट इट डन इन टाइम एज वेल, बिकॉज सम ऑफ दिस बेबीज माइट गो ऑन टू हैव सर्जरी एज वेल. सो सर्जिकल कंसल्टेशन या दूसरी सब स्पेशलिटी जो भी कंसल्टेशन एंड फॉलोअप्स होते हैं वो करनी बहुत ज़रूरी है. अगर कहीं हमें एको रिपीट करना है, कहीं हमें क्रेनियल अल्ट्रासाउंड या एमआरआई करना है, सो अकॉर्डिंगली जो टेस्ट होते हैं वो टाइम पे कराना बड़ा ज़रूरी है. And then usually babies who are high risk, especially preterms या babies जिनको infection हुआ हो, ventilate हुए हों, high jaundice रही हो, ऐसे babies या फिर babies को जन्म के समय issue ही हो, resuscitation significant हुआ हो, ऐसे babies में we what we call is neurodevelopmental assessment at 3 to 4 months of age. Developmental pediatricians होते हैं, and they carry out certain checks to see if the baby is developing normally or not. हमें अगर ऐसा लगता है कि बेबी इज नॉट डेवलपिंग नॉर्मली, देन देयर आर सम स्टिमुलेशन प्रोग्राम्स, वो हम स्टार्ट करते हैं ताकि बेबी हमारा कैचअप करे एज सुन एज पॉसिबल. बेबी शुड गेट बैक टू द नॉर्मल डेवलपमेंटल माइलस्टोन. समटाइम्स इट मे बी पॉसिबल, समटाइम्स इट मे नॉट बी पॉसिबल. सो वो फर्दर ब्रीफिंग होगी व्हेन यू मीट डेवलपमेंटल पीडियाट्रिशियंस. इसके अलावा व्हेनेवर वी मीट इन फॉलोअप्स, व्हाट वी डू इज ग्रोथ मॉनिटरिंग. सो देयर आर सर्टेन स्टैंडर्ड्स फॉर दिस. फॉर एग्जांपल प्रीटर्म्स के लिए फेंटेंस होती है, टर्म बेबीज के लिए WHO IOP की चार्ट्स होती हैं. सो वी प्लॉट बेबीज फिजिकल कैरेक्टरिस्टिक्स जैसे कि वेट, लेंथ, हेड सर्कमफ्रेंस, एंड वी कीप ट्रैक ऑफ द ट्रेन है ना. एक सर्टेन पीरियड ऑफ टाइम में, लाइक फर्स्ट 3 मंथ्स, 6 मंथ्स, 9 मंथ्स, 1 मंथ में कैसा ट्रेन है बच्चे की, जो ग्रोथ है वो कैसी है, वो सेंटाइल्स के हिसाब से ऊपर जा रही है, नीचे जा रही है, सेम है, एंड इट हैज़ गॉट very important significance. So if the baby is growth is faltering, then we need to address is कि भाई weight कम हो रहा है, why the weight is not coming up, is there a scope of improvement in feeding. तो ये सारी चीजें तभी possible है when we plot it, and when plot it as per baby's gestation. As I said, for preterm babies we have different charts, for term babies we have different charts. So these are certain things which as parents we should know. और ये बहुत ज़रूरी है कि आप अपने डॉक्टर अपनी टीम से टच में रहें जब भी बच्चे घर जाते हैं. And it's good to have an emergency number. Most of the hospitals will provide, most of the Cradle hospitals will provide an emergency number of the duty doctor, and you can reach out to the doctor at any point of time. If you have got any doubts, the emergency and triages are there to help you at the time of in VRs like night time hai, agar, if you're not sure, then there will be help available all the time. So the idea is that when you go home, the care has to be continued, and ये जो relationship है between pediatrician and a newborn, it goes on like it's a kind of relationship which is long standing. So it's very important to keep your doctor posted. जब भी आप hospital में आते हैं, it's good to discuss the whereabouts of baby. And as I said, time criticality है. First few days of life we are we want to make sure कि certain things जो checks हैं, जो हमारी vaccination है, जो super speciality support जहाँ पे ज़रूरत है, that are all been done in time. Because if we miss the timelines, we might miss out on certain diseases. If the disease becomes advanced, then it might be more difficult to treat it. For example, as I said, for ROP, if ROP is there are issues in retinopathy, there are issues with retina of the preterm baby. Then, if we do not act in time, the baby might become blind. So it's very important to act in time, to follow the timelines which are mentioned in the summary. Go through the summary. Go through the booklet which is given at the time of discharge, because it has got very important information for baby, and as parents we should learn it. What are the do's and what are the do nots at the time of discharge, what are the danger signs, as I keep saying, पहले भी हमने discuss करा what are the danger signs, right? So these are certain things that as parents we should know, and that is it from my side. If there are any questions, I'm happy to take those questions, please. I'm waiting for the questions. If there are any questions, please go ahead. Anything related to your baby. If your baby has remained in NICU, any questions that you want to ask, any queries that you have got, please go ahead. I think there are no more questions. If there are no questions, I think I should log off. And thank you very much for your kind and patient hearing. If there is anything I can help with, please do get in touch. We are at Apollo Cradle and Children's Hospital in Greater Noida. So anyone living nearby can directly come to the hospital for any questions or queries. And I wish you all the very best. Happy festivity. Thank you very much.